Construction job sites are filled with hazards. Many of them are not easily seen. In this video, Louis, a construction worker, is going to explain one of these hidden hazards.
Hi there, my name is Luis, and I've been working in construction for about 20 years now. During that time, unfortunately, I have seen several co-workers burn on the job site, sometimes from hazards that they didn't even see. A common example of this is getting a chemical burn from concrete. Concrete, as you know, is one of the most widely used materials in construction, right? However, it can be surprisingly dangerous. Skin injuries from concrete can range from a minor irritation and dryness to permanently disabling and disfiguring burns. Now, I know what you're thinking. I work with concrete all the time and I never been burned. Well, that's exactly why concrete can be so dangerous, because many people are exposed to it all the time with little to no effect, but others aren't so fortunate. Under the right conditions, such as long exposure time and low level of moisture on your skin, wet concrete can create severe damage to your skin.
So, how exactly do these injuries occur?
Well, first, concrete is highly abrasive due to the texture of the cement, sand, and aggregates it contains, all of which can weaken and irritate the outer layer of your skin. Second, concrete is hygroscopic.
Hygro what?
Hygroscopic, that means that it absorbs water, including the moisture from your skin. And third, the reaction of cement and water gives off heat. So, between the abrasion, moisture absorption, and heat, you may have noticed how dry and red your skin is after working with concrete.
Okay, my skin is red, and so what?
Well, now that the outer layer of your skin is deteriorated from the concrete exposure, longer exposure to wet concrete can lead to more serious problems. When Portland cement mixes with water, it forms a highly caustic base. You may remember the pH scale from school, which ranges from 1 to 14. Water is pH neutral at 7. Acids have a pH less than 7, and bases have a pH greater than 7. The farther you move away from water towards either strong acids or strong bases, the more dangerous these chemicals can be for your skin. It turns out that the mixture of Portland cement and water produces a chemical called calcium hydroxide, which is very, very basic, with a pH of around 12 to 13. This caustic chemical then reacts with your skin and begins destroying the proteins in the outer layers of your skin, quickly working to the inner layers. This skin destruction has the exact same effects as a thermal burn. Burns to the outer layer of the skin, called the epidermis, are considered a first-degree burn. As the reaction between the wet cement and your skin continues, it can penetrate the second layer of skin, the dermis. These burns typically require medical treatment and possibly even skin grafting. If the reaction continues, then you can get a third-degree burn. These burns often require hospitalization in a specialized burn unit, with recovery times measured in months. Exposure to wet concrete can result in any of these type of burns, which usually occur over the course of several hours. This highlights another big challenge of concrete burns. By the time that you start feeling a burning sensation, it's usually too late. The burn has already started. And even after removing the concrete, at this point, the chemical reaction may continue down into the lower levels of skin. In such cases, you need to seek medical attention immediately. Another hazard from concrete, particularly to the hands and arms, which may be exposed hundreds of times over the course of a career, is concrete dermatitis. This can be a short-term problem or turn into a long-term problem if an allergy develops. Cement contains a chemical called hexavalent chromium, which most people can develop an allergy to. Whether a short-term irritation or a long-term skin allergy. The symptoms can include redness, pain, swelling, itching, and even blisters.
So, how can we avoid these injuries?
Use the right PPE. This PPE should include waterproof boots and please tuck the pants inside them. Waterproof knee pads, eye protection, proper gloves, and also avoid wearing watches or jewelry that can trap wet concrete against your skin. The second component of preventing concrete burns is proper skin care. Wash any concrete affected area with cool water. Do not wash with abrasive cleansers. It is imperative that you remove the concrete from your skin as quickly as possible.